The gaslight flickers against mahogany walls. A woman's fingers grip bed sheets until her knuckles turn white. She has been lying here for 6 weeks, forbidden to read, forbidden to write, forbidden even to sit up without permission. The wallpaper watches her with its grotesque pattern, seeming to move, to breathe, to mock. This is Philadelphia, 1887. The woman is a new mother, and she has made the mistake of telling her husband she feels unwell. The greatest nerve specialist in America has prescribed his cure: complete rest, complete isolation, complete surrender of will. She must not think. She must not create. She must not question. She is being cured of the disease of being a woman who dared to have a mind. This is not fiction. This is Charlotte Perkins Gilman, and she is undergoing Dr. Silas Weir Mitchell's rest cure. The same treatment that would drive countless women to madness in the name of healing them from an illness that never existed. But Gilman's story is merely one thread in a tapestry of medical horror that stretched across centuries, across continents, a systematic perversion of healing that turned the female body into a battleground and medicine into an instrument of control. For more than 2,000 years, from ancient Greece to the gaslit parlors of Victorian England, the medical establishment waged a war against the female body, against female autonomy, against the very notion that a woman could exist without being fundamentally, pathologically broken. They called it hysteria, from the Greek hystera, meaning womb. They believed the uterus could detach and wander through a woman's body like some parasitic creature, causing everything from anxiety to epilepsy, from fatigue to the unforgivable sin of having opinions. The cure, according to Hippocrates himself, was marriage and pregnancy. The cure was submission. The cure was to fulfill what men decided was woman's only purpose. Think of the grandeur of Victorian medicine, the age of discovery, the century that gave us anesthesia, antisepsis, the germ theory of disease, medical colleges rising like cathedrals to science, learned men in their black coats making rounds through gleaming new hospitals, bringing the light of reason to the darkness of suffering. This was progress. This was civilization advancing. The same doctors who were learning to prevent childbed fever, who were mapping the nervous system, who were beginning to understand the mysteries of human physiology, looked at half the human race and declared them constitutionally diseased. Consider the cruel irony. At the very moment when medicine was becoming a science, when empirical observation was replacing superstition, the treatment of women remained trapped in a mythology as old as civilization itself. The wandering womb of ancient Greece became the irritable uterus of Victorian England. The prescription of marriage and childbearing from Hippocrates became the enforced domesticity of the rest cure. The symptoms changed with the fashions, but the diagnosis remained constant. To be female was to be ill. The statistics are staggering. In 1913, a study estimated that 75% of all women suffered from hysteria. 3/4 of the female population declared medically unsound. The symptoms that earned this diagnosis read like an inventory of human experience: headache, fatigue, anxiety, sexual desire, lack of sexual desire, reading too much, thinking too much, laughing too loudly, crying too quietly. A woman could be diagnosed with hysteria for almost any behavior that deviated from the suffocating ideal of the angel in the house. Even the desire for education, for work outside the home, for political participation, these were symptoms of a diseased mind requiring medical intervention. But it was not enough to simply diagnose. The medical establishment had to cure, and the cures they devised reveal more about the psychology of power than now any political treatise ever could. In ancient times, they hung women upside down to shake the uterus back into place. They applied foul-smelling substances to the nose and sweet fragrances to the genitals to lure the wandering womb home. Medieval physicians prescribed fumigations with bull urine, The Renaissance brought us bloodletting and purging. But it was the Victorian era, that pinnacle of propriety and progress, that perfected the art of medical subjugation. Enter the examination room. A Victorian gynecologist. The instruments arrayed on the table tell a story of their own. The speculum, reintroduced to medicine after centuries of absence, now a tool of controversy because it gave doctors visual access to women's most intimate. Anatomy. Genitive. Many physicians worried that the mere insertion of the device would cause instant arousal. Such was their belief in female moral weakness. The uterine curette, with its sharp edges designed to scrape the womb clean of whatever corruption the doctors imagined resided there. These were tools of healing, they said, but also tools of control. Instruments that turned the female body into territory to be explored, mapped, conquered. The treatments themselves ranged from the absurd to the absurd. Barbaric. Leeches applied to the vulva to draw out excess blood and calm the overexcited nerves. Ice water douches to shock the system back to propriety. Clitoridectomies, the surgical removal of the clitoris, performed on women and girls who showed signs of masturbation or excessive sexual desire. Dr. Isaac Baker Brown, a prominent London surgeon, performed these mutilations throughout the 1860s on women whose symptoms included everything from epilepsy to the desire for divorce. He published his results with pride, claiming cure rates that would make any charlatan blush. But perhaps no treatment captures the essential perversity of Victorian medical misogyny quite like the pelvic massage. Here we encounter one of history's most bizarre contradictions. Physicians who believed that female sexual desire was a symptom of disease, who warned that masturbation could cause insanity and death, who covered piano legs because they might excite impure thoughts. These same guardians of morality regularly administered what they called manual therapy to their female patients. The treatment involved the doctor stimulating the woman's genitals until she experienced what they termed a hysterical paroxysm. We have another word for it. Today, they were giving their patients orgasms and calling it medicine. The cognitive dissonance required to maintain this practice staggers the mind. These physicians genuinely believed they were performing a medical procedure. The sexual release they induced was not pleasure but a symptom, not an orgasm but a crisis that relieved the pressure of the wandering womb. When the treatment became too time-consuming, when their hands grew tired from the hours of massage required to achieve the desired paroxysm, they invented machines to do the work for them. The electric vibrator, that symbol of female sexual liberation, was born not from a desire to give women pleasure, but from doctors' exhaustion at having to manually stimulate their male patients to orgasm while denying that's what they were doing. Dr. Joseph Mortimer Granville patented his electric vibrator in 1883, marketing it specifically to physicians for the treatment of hysteria. Within decades, dozens of models flooded the medical market. The Chattanooga vibrator, a massive apparatus that looked more like industrial machinery than medical equipment. The vibratile, which promised to deliver 60 pulses per second. These devices were advertised in medical journals with the same clinical detachment as surgical instruments. No one spoke of pleasure. No one acknowledged what was actually happening in those treatment rooms where women lay with their skirts raised, while doctors or their assistants applied vibrating instruments to their genitals in the name of medical science. Yet even this bizarre sexual therapy pales in comparison to the rest cure, that ultimate expression of medical control over the female body and mind. Developed by Dr. Silas Weir Mitchell. In the aftermath of the American Civil War, the rest cure represented the medicalization of female subjugation raised to the level of systematic torture. Mitchell, who had treated soldiers for battle fatigue, turned his attention to the epidemic of nervous exhaustion among middle and upper-class women. His diagnosis was simple. Modern women were overtaxing their delicate constitutions by thinking too much, reading too much, attempting to participate in the masculine spheres of education and masculine spheres of education. professional life. His cure was equally simple: complete inactivity. The rest cure patient was confined to bed for 6 to 8 weeks. She was forbidden to read, write, sew, or engage in any mental stimulation whatsoever. She could not feed herself or attend to her own hygiene. She was bathed and fed by nurses like an infant. She was not allowed visitors except for the doctor. She could not leave her room. She could not even sit up without permission. The treatment included forced feeding, often to the point of painful fullness, with a diet heavy in milk and meat, designed to add weight to the patient's frame. Some women gained 50 pounds during their confinement. Mitchell believed that fattening the body would calm the mind, that adding flesh would somehow subtract thought. The psychological torture of the rest cure cannot be overstated. Intelligent, creative women were reduced to the status of infants, stripped of all autonomy, all agency, all identity beyond that of patient. They were punished for the crime of having minds that refused to conform to the suffocating limitations of Victorian femininity. Jane Addams, founder of Hull House and future Nobel Peace Prize winner, underwent the rest cure and later wrote of lying in bed, forbidden to move, feeling her mind begin to fracture from the enforced inactivity. Virginia Woolf endured multiple rest cures throughout her life, each one pushing her closer to the madness they claimed to cure. She would later write with bitter clarity about the experience of being treated by doctors who saw her not as a human being, but as a recalcitrant womb attached to an inconveniently active brain. But it was Charlotte Perkins Gilman who gave us the most damning testimony of the rest cure's horror. After undergoing Mitchell's treatment, she suffered a complete nervous breakdown, reduced to crawling into closets and under beds, clutching a rag doll, her mind shattered by the cure that was supposed to heal it. She recovered only by doing exactly what Mitchell had forbidden. She left her husband, she took up her pen, she returned to work. Her story, The Yellow Wallpaper, stands as one of the most powerful indictments of medical misogyny ever written. Gothic horror story that was simply autobiography with the names changed. Mitchell knew what he was doing. In his own writings, he was remarkably honest about the punitive nature of the rest cure. He wrote with satisfaction about how women who had been difficult, who had resisted their domestic duties, who had claimed illness to avoid their responsibilities, how these women were so broken by the rest cure that they begged to be allowed to return to their proper roles as wives and mothers. What is cure worked not by healing but by making the alternative to conformity so unbearable that women would accept any chains rather than endure another day of medical treatment. The rest cure was not administered in asylums or prisons, but in the finest hospitals and private clinics, in the homes of the wealthy. The women who underwent it were not criminals or lunatics, but wives and daughters of prominent men. Women whose only crime was displaying symptoms of intelligence, ambition, or simple human unhappiness with their constrained existence. The treatment was not a last resort, but a first response to any sign of female nonconformity. A woman who wanted to attend university might find herself in bed for 2 months being force-fed creep. A woman who suffered from postpartum depression might be separated from her child and forbidden to write letters. A woman who dared to say she was unhappy in her marriage might be diagnosed with moral insanity and subjected to treatments that would cure. Or break her will to complain. The medical establishment's approach to female hysteria reached its grotesque apotheosis in the surgical solutions of the late Victorian era. If the wandering womb was the problem, why not simply remove it? Hysterectomies and oophorectomies, the surgical removal of the uterus and ovaries, became fashionable treatments for everything from depression to nymphomania, to the tendency to read novels. Dr. Robert Batty of Georgia pioneered what he called normal ovariotomy, the removal of healthy ovaries to cure mental illness. Women were castrated for masturbation, for sexual desire, for refusing to marry, for wanting a divorce, for any behavior that challenged male authority. The surgery was performed without the patient's consent in many cases. Husbands and fathers could authorize the removal of a woman's reproductive organs if they deemed her behavior inappropriate. Women woke from chloroform to discover they had been sterilized, their capacity for motherhood stolen along with whatever independence of spirit had marked them as diseased. Dr. Richard Maurice Buck, superintendent of the London Asylum in Ontario, performed hundreds of these surgeries on female patients, removing reproductive organs from women whose only illness was poverty, immigration, or the inability to speak English. He presented his findings at medical conferences to great acclaim, his mutilation of helpless women applauded as progressive treatment. The scope of these surgical interventions beggars belief. At the London Asylum alone, between 1895 and 1901, Bucca performed over 200 gynecological surgeries on female patients. The mortality rate was staggering, but this was considered an acceptable risk. In the war against female insanity, women died on operating tables, their abdomens opened, their organs removed, all in service of the belief that female biology was pathology, that to be a woman was to require surgical correction. Consider the case of Winifred Howells, daughter of the famous author William Dean Howells. She was sent to Dr. Mitchell in 1888 for treatment of what was assumed to be hysteria. Mitchell diagnosed her as obstinate, full of hypochondriacal delusions. He began his regime of force-feeding, dismissing her complaints of pain as the manipulations of a difficult woman. She died under his care. The autopsy revealed organic disease, a physical ailment that Mitchell had dismissed as female theatrics. Her father wrote, in anguish, that perhaps his daughter's pain had been real all along, that she had suffered and died while her doctor refused to believe her testimony about her own body. This was not an isolated incident. The medical literature of the period is littered with cases of women who died from unnecessary surgeries, who killed themselves to escape the rest cure, who emerged from treatment more damaged than they entered. But these deaths, these destroyed lives, they changed nothing. The medical establishment had created a perfect closed system. If a woman recovered, it proved the treatment worked. If she didn't recover, it proved she was incurable. If she complained, it was a symptom of her hysteria. If she complied, it showed she was getting better. There was no testimony a woman could give about her own body, her own mind, that could not be dismissed as manifestation of disease. The treatment of hysteria was never about healing. It was about control. It was about maintaining a social order that required women's subjugation for its survival. Every diagnosis of hysteria was a political act. Every treatment was an enforcement of gender hierarchy. The doctors were not healers but enforcers, their prescription pads weapons in a war against female autonomy. They medicalized rebellion and pathologized independence. They turned suffering into silence and silence into compliance. The hysteria diagnosis also served a more insidious function. It obscured real illness, real suffering, real injustice. Women with thyroid disorders, diabetes, epilepsy, cancer. These legitimate medical conditions were dismissed as hysteria. Women suffering from the psychological effects of abuse, of powerlessness, of lives constrained by suffocating social roles. Their distress was not addressed, but suppressed. The hysteria diagnosis was a wastebasket into which the medical establishment threw everything about women they didn't understand or didn't want to acknowledge. But there is another layer to this historical horror, one that reveals the depth of the perversion. The same medical establishment that diagnosed women with hysteria for displaying sexual desire also believed that women were naturally asexual, that only diseased women experienced sexual pleasure. They created an impossible paradox. Women must be pure without sexual feeling, but also their wombs were so powerful, so demanding, that they could cause madness if not properly satisfied through marriage and childbearing. Women had to be both sexless and consumed by their sex, both pure and pathological, both angels and mad women. This paradox was resolved through the figure of the doctor, particularly the gynecologist, who became a kind of secular priest, with unique access to female bodies and female secrets. The gynecological exam became a ritual of medical authority, with elaborate protocols designed to preserve the fiction of medical objectivity while allowing unprecedented, intimate access. Women were examined behind screens under sheets, sometimes without the doctor even looking at what his hands were doing, all to maintain the pretense that this was medicine, not violation. The power dynamics of these medical encounters cannot be ignored. Women, already legally subordinate to their husbands and fathers, found themselves at the mercy of male doctors who claimed absolute authority over their bodies. These doctors could prescribe treatments that stripped women of their autonomy, their fertility, their sanity, all with the blessing of law and custom. A woman who refused treatment could be declared insane and committed to an asylum. A woman who questioned her diagnosis could have that questioning taken as proof of her illness. The medical establishment had created a totalitarian system where dissent was disease and compliance was the only cure. The asylum system represented the ultimate expression of medical control over female bodies and minds. By the end of the 19th century, women made up the majority of asylum populations across Europe and North America. They were committed for reasons that reveal the true nature of psychiatric diagnosis: poverty, promiscuity, pregnancy, outside marriage, refusing to marry, wanting a divorce, postpartum depression, menopause, reading too much, political activism. The asylum was where inconvenient women were disappeared, where female suffering was rendered invisible behind walls that respectable society could ignore. Inside these institutions, women faced treatments that can only be described as torture. Hydrotherapy, which sounds benign, meant being wrapped in cold, wet sheets for hours, being subjected to high-pressure water jets, being held underwater until near drowning. The bath of surprise involved suddenly dropping a patient into cold water to shock her system. Women were spun in rotating chairs until they vomited, hung from the ceiling in straitjackets, subjected to induced insulin comas. These were not treatments but punishments, designed to break the will, to force compliance through suffering. The case files from these asylums read like catalogs of stolen lives. Mary Hughes, admitted to the London asylum for grief after her child's death, spent 40 years in confinement, her sorrow pathologized into madness. Elizabeth Packard, committed by her husband for disagreeing with his religious views, fought for years to prove her sanity, while doctors insisted her desire for freedom was itself proof of illness. Thousands upon thousands of women vanished into these institutions, their voices silenced, their stories erased, their lives reduced to entries in medical records that described them only in terms of their symptoms, their compliance, their curability. The tragedy extends beyond the individual women who suffered. The medical pathologization of femaleness poisoned generations of women's relationships with their own bodies, their own minds, their own experiences. Women learn to distrust their perceptions, to doubt their emotions, to fear their own desires as symptoms of disease. They internalize the medical gaze that saw them as inherently pathological, as bodies in constant need of surveillance and correction. Mothers passed this poisoned inheritance to daughters, teaching them that to be female was to be fragile, unstable, requiring constant medical management. The echo of Victorian medical misogyny reverberates through time. The hysteria diagnosis may have been officially retired in the 1950s, but its ghost haunts every woman who has been told her pain is all in her head, every woman whose legitimate medical complaints have been dismissed as anxiety, every woman who has been prescribed psychiatric medication for physical symptoms that male doctors couldn't immediately diagnose. The wandering womb has been replaced by the anxious female patient, the hysterical woman by the difficult woman, but the underlying assumption remains: women's testimony about their own bodies is inherently suspect, consider how this history shapes contemporary medical practice. Women wait an average of 4 years longer than men for a diagnosis of the same conditions. They are more likely to have their pain dismissed, their symptoms attributed to psychological causes, their concerns minimized. They are more likely to die from heart attacks because their symptoms are dismissed as anxiety. They are more likely to suffer from autoimmune conditions that go undiagnosed for years because their fatigue, pain, and systemic symptoms are attributed to depression or stress. The ghost of hysteria diagnosis means that even today, in the 21st century, women must perform their suffering correctly. To be believed, must navigate medical encounters that still carry the assumption that female bodies are unreliable narrators. The #MeToo movement has revealed how powerful men across industries have exploited and abused women with impunity. But we must remember that this abuse was medicalized, rationalized, and enabled by a medical establishment that declared women's testimonies inherently unreliable. When women in the Victorian era tried to speak about sexual abuse, they were diagnosed with erotomania or nymphomania. When they reported rape, they were examined for signs of hysteria. The medical establishment provided the theoretical framework that allowed society to dismiss women's voices, to pathologize their resistance, to medicalize their oppression. We must also acknowledge the role that women themselves played in perpetuating these systems. Female nurses administered the rest cure. Female attendants enforced asylum rules. Mothers brought their daughters to doctors for hysteria treatment. This complicity was not freely chosen but coerced by a system that offered women only two roles: patient or caretaker, victim or accomplice. Women who worked within the medical system had to enforce its misogyny to maintain their own precarious positions. They became agents of the same oppression that confined them, perpetuating cycles of medical violence that would consume their own daughters. The history of hysteria treatment forces us to confront uncomfortable questions about medical authority, bodily autonomy, and the politics of diagnosis. Who decides what constitutes illness? Whose testimony about bodies is considered credible? How do social prejudices become medical facts? These are not merely historical questions, but urgent contemporary concerns as we grapple with transgender healthcare, reproductive rights, and the ongoing pathologization of difference. The Victorian doctors who diagnosed hysteria, who performed clitoridectomies, who enforced rest cures, they were not outliers or extremists. They were respected members of their profession, published in prestigious journals, lauded at medical conferences. They believed themselves to be moral, scientific, progressive. They thought they were helping women, saving them from themselves, curing them of the disease of being female. This should terrify us. It reveals how medical authority can be weaponized, how the language of care can mask systems of control, how the entire apparatus of scientific medicine can be turned into an instrument of oppression while maintaining its claim to objective truth. The women who survived these treatments, who found ways to resist, who wrote their testimonies despite being forbidden to hold pens, they are the unsung heroes of medical history. Charlotte Perkins Gilman, who turned her trauma into literature that exposed the rest cure's cruelty. Elizabeth Packard, who fought for laws protecting married women from involuntary commitment. The countless unnamed women who found ways to resist, to preserve their sanity despite treatments designed to destroy it, to maintain their sense of self despite medical systems that denied their basic humanity. Their courage in the face of medicalized oppression stands as testament to the resilience of the human spirit and the persistence of truth, despite systematic attempts at silencing. But we must not comfort ourselves with the notion that this is all in the past, that we have evolved beyond such medical barbarism. The same week you watch this, somewhere a woman is being told her chronic pain is just stress. Somewhere a woman is being prescribed antidepressants for what will later be diagnosed as a thyroid condition. Somewhere a woman is being committed for behavior that would be tolerated or even celebrated in a man. The mechanisms have become subtler, the language more sophisticated, but the fundamental assumption that female bodies are problematic, unreliable, in need of medical management. This poisonous idea persists. The lesson of Victorian hysteria treatment is not that past doctors were uniquely cruel or past women uniquely oppressed. The lesson is that medicine, like all human institutions, reflects and reinforces the power structures of its society. When society sees women as inferior, medicine will find ways to pathologize femaleness. When society denies women autonomy, medicine will develop treatments that strip autonomy away. When society silences women's voices, medicine will diagnose speaking out as disease. This is why the history of hysteria matters. Not as a curious medical antiquity, not as a shocking tale from less enlightened times, but as a warning about how power operates through the language of care. How oppression disguises itself as treatment. How violence can be medicalized into respectability. The Victorian doctors who tortured women with rest cures and surgeries believed themselves to be healers. They wrote earnest papers about helping suffering women. They convinced themselves that women's screams were symptoms, that women's resistance was disease, that women's testimony about their own bodies was inherently unreliable. We live in the shadow of this history, whether we acknowledge it or not. Every woman who's been disbelieved by a doctor carries the ghost of hysteria diagnosis. Every medical study that fails to include female subjects perpetuates the assumption that male bodies are the default and female bodies are deviations. Every time women's anger is pathologized as hormonal, their ambition as unfeminine, their suffering as hysteria by another name, we see the persistence of Victorian medical misogyny in modern dress. The path forward requires not just better medical practice, but a fundamental reckoning with how medicine has been used as a tool of oppression. It requires acknowledging that medical authority has been weaponized against marginalized bodies throughout history. It requires centering the testimonies of those who have been pathologized, believing patients about their own experiences, recognizing that diagnosis is never purely objective, but always shaped by social assumptions about whose bodies matter, whose pain is real, whose voices deserve to be heard. If this story has left you unsettled, if it has revealed the hidden violence beneath medicine's veneer of care, if it has made you question what other horrors hide behind professional authority and scientific language, then you understand language, why these stories must be told. Like this video, if you believe that confronting historical injustice is essential to preventing its repetition. Share it with those who need to understand that women's struggle for bodily autonomy has deep roots and ongoing relevance. Subscribe to this channel as we continue to excavate the buried histories, the silenced voices, the systematic cruelties that shaped our present world. Remember this: the women diagnosed with hysteria, subjected to rest cures, mutilated by surgeries, confined in asylums, they were not victims of random cruelty, but casualties of systematic oppression that used medical authority to enforce social hierarchy. Their suffering was not meaningless, but political. Their silencing, not accidental, but deliberate. By remembering them, by speaking their names, by refusing to let their stories be buried beneath medical euphemism and historical amnesia, we honor their suffering and guard against its repetition. Only by telling these truths can we strip medicine of its pretense to pure objectivity and finally hear the voices of those who were diagnosed into silence, treated into submission, cured into compliance, their bodies made into battlegrounds where the war for human autonomy was fought, and too often lost.